One of the hardest parts of dental photography, and one which is the most important, is retraction. And this, combined with the fact that you are retracting whilst also placing a mirror in the mouth, means you need to have a lot of patience, assistance, stability and control. In this video, I'll just go through a few techniques to assist you in the retraction process. So, the main aim of retraction is to retract the soft tissues away from the area of interest. And for the benefit of this demonstration, this area of interest will just be all the tooth surfaces. So first, what you want to do is ask the patient to lick their lips and then place the retractors in one cheek at a time. If you don't have an assistant doing this and you are relying on the patient to retract, I'd recommend retracting for them first and then asking them to hold the retractor rather than handing them a retractors and trying to guide them. For the anterior view, we're aiming to keep the retractors horizontal. We also want to avoid the retractors being pulled backwards, as this pushes the buccal up against the posterior teeth. Ensure retraction is at maximum by reminding the assistant or the patient to keep the tension. When undertaking the lateral or oblique view, we don't need as much retraction at the side we're not photographing, so we can reduce the tension on that side, which then allows you to pull back a bit further on the side of interest. So relax one side and pull back on the other. And this step is obviously repeated when you're taking pictures from the other side. When you're undertaking mirror views, use the small side of the small retractors. This helps avoid the retractors getting in the way of the mirror. I'd recommend heating up the mirror using any hot water, any clean hot water, or any approved heating mechanism to avoid the fogging. But I do tend to avoid any steaming mirror products as they blow warm circulated air into the mouth. When inserting the mirror for the upper arch view, place the retractors horizontally, and then once the mirror is in position, angle them at 45 degrees, and this stops the lips covering the incisal edge. Ask the patient to open wide, and you're aiming for all the teeth to be in shot and the occlusal surface angled so that it is perpendicular to the camera lens. Asking the patient to breathe through their nose will also help avoid fogging if the process is taking longer than expected. Try to avoid resting the mirror on the posterior teeth or using the mirror to lever the patient's mouth open. That sometimes happens when you're using one of those handles. The step that you've just undertaken there is then repeated for the lower arch view. I think the main thing of mirror and retraction is that it's a technique that takes time and practice, and there's no one way of doing it that's simplified, makes it really quick. And of course it also depends on the subject that you're photographing. You know, you could have an easy patient one minute, difficult patient the next. So there's many variables that are taken into consideration when you're doing this technique. And again, like I've said in other videos, the more times you do it, the easier it will become, and practicing or just undertaking it more often will make it a bit easier for you to undertake this kind of thing.